All right, if you can close the door for me, that'd be great. Good morning to all of those of you who've kindly joined us this morning to discuss the new Flagler Signature Plus Concierge program, which is going to be up and running shortly at the new facility in Nocatee, which Flagler is building and will be hopefully up and running in October. I want to thank you for joining me so that I can spend some time with you this morning explaining a couple of aspects to the practice that I've been asked to develop for Flagler Hospital. A little bit about me before I delve into the specifics of the program here. My background is in internal medicine. I'm board certified in internal medicine. I trained at both Cleveland Clinic and Mayo Clinic. I stayed on staff at Mayo Clinic in Jacksonville for 13 years prior to taking this position with Flagler. And during that time, for the majority of the time, I was the chairman of Executive in International Medicine. Flagler offered me an opportunity to get in on the ground floor to build a new concierge medicine program, which I think is going to bring great value to residents of not only Nocatee, where the primary facility will be located, but I suspect we will see interest from patients throughout the Jacksonville community. As far as concierge medicine is concerned, this is a concept which is relatively new in the modern era, although most of us can probably remember the medical drama show Marcus Welby. Medicine has changed a lot, as we all know, particularly over the last 3 to 4 decades. It has resulted in a bifurcation of healthcare access in such a way that it has made it more difficult in many ways for patients to access timely care or to actually see their physician rather than a mid-level provider. There have been issues which have been increasingly problematic, in my opinion, in medicine, whereby reimbursement rates for doing work such as internal medicine and taking care of patients and spending time with patients have become more problematic and difficult for the institutions who employ these physicians. And therefore, the time spent with a patient and the amount of time we are able to spend listening to patients' problems, considering possible diagnostic modalities, considering possible diagnoses, have all been time pressured. And there have been significant reductions in satisfaction, both on the provider side and, more importantly, on the patient side. Having said that, the technology of medicine has gone rapidly forward since even the late 1950s, when Watson and Crick discovered DNA. If you look at the ability to provide life-saving medical care in an intensive care unit setting, or frankly, even the advances that have been made in medications and technology for diagnosis, they have all been tremendously beneficial to improvement in outcomes in both acute and chronic settings from a technology standpoint. What has not followed suit, and in fact, in my opinion, has gone the opposite direction, is the physician-patient relationship and the ability to spend time with your doctor, to have your doctor truly have a schedule which allows he or she to listen to you, to delve deeply into your, not only your medical issues, your interpersonal, your spiritual, emotional well-being, And that comes from developing a true friendship with patients over the course of time. What I found over the course of years, even working at my former institution, was that while their moniker and their motto was largely based upon time spent with the patient, that even there became a more pressured approach to making sure more patients were seen to maintain a slim margin. The beauty of concierge medicine is that it allows both the physician and the patient to develop a relationship over time that is based upon time spent with the patient, which in turn leads to a level of understanding between the doctor and the patient, working in tandem as a team. The concierge medicine programs, which have cropped up across the country and have rapidly grown over the course of time, have oftentimes used the analogy of somebody sitting in first class on an airplane versus somebody sitting in coach or main cabin or what have you. And the argument that I've heard made is that you all get to the same place and you all get there safely, but the folks in first class experience a different level of service. Well, that's true. There's no question about the fact that the ability to be able to see me either the same day or the following day, the ability to have access to me 24/7 by phone, text, or email, which will be the case no matter where I am in the country, including if I'm traveling for vacation or for conferences. That all is extremely beneficial for many patients. I found this to be true when I worked at Mayo because time for many people is money, but more importantly, time is immutable in the sense that having the time to spend with someone with expertise to explain your medical concerns, your personal concerns, it leads to a different outcome, frankly. And this gets back to the analogy I mentioned moments ago about first class versus flying coach. I would actually go further than that. I think there's ample evidence that with a high quality internal medicine physician in a concierge medicine program, that you not only get enhanced services in the sense of more opulent setting in which you're being seen, you get to spend more time with the doctor, you get enhanced access in terms of same day or next day visits, and of course remote access, as I mentioned. But studies have been pretty clear on this. I read a recent journal article which is very interesting. The average primary care physician has around 2,400 patients in his or her practice panel. And the authors of this study extrapolated that if you really had that many patients in your practice who came in either annually or more frequently, which was often the case, that by having that many patients to have to take care of, you would literally need to have over 21 hours in your working day to be able to address all of their acute and chronic medical problems. Obviously, that doesn't happen. I did work for an institution briefly, and this is another anecdote that I think is helpful to understand where medicine is going. After I left Mayo, I went back to my hometown in Ohio for about a year, and I realized pretty quickly how medicine had changed. I'd been in a bit of a bubble. And it was suggested that if a patient had, let's say, 5 medical problems, hypertension, diabetes, coronary artery disease, hyperlipidemia, high cholesterol, and kidney disease, I'll just give you those as examples. They were, as an institution, encouraging the physicians to only address one problem per month for their physical, which means that a patient would come in and see the doctor and spend maybe 5 or 10 minutes going over their blood pressure medication. They would come back the next month and go over another issue the next month, and so on and so forth. Of course, the natural question I had, which I was loath to ask as I was just onboarding at the time, was how does this affect patient outcomes? And obviously, I think anyone, even without medical training, knows that if this is the trend that medicine is taking, which it is, that fragmented healthcare is only going to get worse and not better. As far as time spent with patients, there are other studies which have clearly shown, at least based on observational results, that the ability to spend time with the patient, listen, think critically, put on the mental thinking cap for the physician, actually taking time from the history has been shown to provide about 85% of accurate diagnoses before any additional testing is undertaken. And that is a huge advantage to concierge medicine. My practice is going to have an open format. Obviously, if we have patients coming in and wanting to be seen on the same day, we will do our best to accommodate them, but we'll guarantee that if we can't see them the same day, we can chat by phone and or we could see the patient the following day. But the mere fact that taking a good history, which requires time, can and does typically result in an accurate diagnosis in 85% of cases, even before testing and a physical exam is conducted, really demarcates what a concierge medicine practice is able to offer versus a traditional primary care practice. I mentioned that the average primary care physician has somewhere between 2,300 and 2,500 patients in his or her practice. My practice is going to be limited to no more than 400 patients at any given time. And again, that allows me the opportunity to spend quality of time with patients in an unrushed environment, in a calming setting. And I'd like to believe that I'm a very good diagnostician. My years in my previous training and where I worked, I believe, helped me to improve the quality of care that I provided over time. So I feel very confident that I can provide good diagnostic services, but also a holistic approach to your care. On top of the concierge component of the program, I also have fellowship training in integrative medicine. Many of you are probably aware of the advent of complementary and alternative medicine in the United States. I prefer not to use that term, and I'll explain why. Integrative medicine is the term that is really more appropriate, I think, to use to discuss some of the modalities that are available in an integrative medicine practice versus a traditional, merely allopathic practice. I completed a fellowship at the University of Arizona with Dr. Andrew Weil, which many of you may have heard of, who's a very well-known integrative medicine physician from Harvard. And that was a 2-year fellowship, which I completed in 2009. And since that time, I've incorporated, to the best of my ability, particularly if there's interest among patients, the integrative medicine component to my discussions. So I did this when I worked at Mayo Clinic as well. And that's something I think that adds value because I know there are many patients who go to their physicians and the answers are typically take this medication, add this medication, subtract this medication, let's do this, let's try this. And many people, for good reason, don't want to take more medication. There are side effects. There are, a number of issues to consider in terms of efficacy, benefit versus possible risks. So my practice also incorporates an integrative medicine component. We will be offering an annual complimentary 1-hour integrative medicine consultation visit as part of the program as well. And for those who are more interested in really delving deep into opportunities for pursuing integrative modalities for treatment, I'm very well versed in that spectrum of care. And when I refer to that, I'm talking about herbal remedies, antioxidant supplements, chiropractic, although I have a particular preference for a particular type of chiropractic treatment based upon the scientific design, which I can explain to patients who are interested in that. And we are also looking at acupuncture and a number of other modalities, which, frankly, there are some very legitimate alternatives to medications. If patients would either like to try these alternatives or simply do not want to add to their medication list. So the upshot of integrative medicine incorporated with the concierge medicine program is that I will have the opportunity to spend as much time as is necessary to address your needs and to spend time putting my thinking cap on and coming up with potentially diagnoses that others may not have found. I may be able to offer treatment modalities which others may not have thought of. But more importantly, this is about an interpersonal relationship. I often considered my patients when I worked at Mayo Clinic, who I saw for many years over the course of my career there, year in and year out, to become friends. And there's nothing wrong, in my opinion, with having that type of relationship with your physician, and I think it's a healthy thing. It's my passion to maintain a practice that does not fall within the purview or the style of practice that I'm seeing across the country now. You're seeing group visits in many institutions. You're seeing, well, as an example, when I was in Ohio, I saw many patients who transferred to me from their prior primary care physician, whether or not it was a internist or a family practitioner, and I had several of the patients, and they were in the same institution that I worked for, a large hospital system up there. And I was conducting an exam one day on a patient, and he said to me, as I was listening to his carotid arteries in the neck with my stethoscope to see if I could hear any swishing sounds, which could indicate a blockage. And of course, I performed a full physical examination, and then ordered complete blood work and had him come back. And during the examination, he said to me, "What are you doing? What are you listening for? What are you examining? Can you explain to me what it is that the exam is looking for?" And of course, I was happy to explain that to him in detail. And then he revealed to me that in the 10 years he had been seeing this other physician he had transferred from, who also, again, was employed by the same hospital system, he said to me, "My physician never touched me." And I stepped back and I said, "Do you mean your physician never performed a full physical examination on you?" And he said, "No, my physician has only seen me once in the 10 years I was in his practice, after which he transferred my ongoing care to his physician assistant, and I never saw him again." And throughout the 10 years, either the first year or subsequent years with the physician assistant, I never received any examination whatsoever. I didn't have my lungs listened to. I didn't have a cardiac exam. I didn't have a prostate exam. I didn't have a pelvic exam. I didn't have a breast exam. Nothing. They literally did not lay hands on this gentleman. I was a little skeptical, but I heard this from many, many patients over the course of the year that I was up there. And yet the physicians were documenting full physical examinations. I guess the bottom line is that, unfortunately, this is how medicine has evolved over time. There are a lot of reasons for this, mostly reimbursement. To be very honest, reimbursement has declined over time for physicians relative to inflation. It's not to say physicians don't still do well, but the institutions that employ these physicians have, in my opinion, abrogated their responsibility to do the right thing for the next quarter's results. I'm very happy to be working for Flagler. Flagler reached out to me. Their CEO, Jason Barrett, is a true visionary who wants to bring a different level of care to St. Johns County and the surrounding area. And he felt strongly, and I was very pleased to hear this, that offering this type of traditional practice without time pressures, the way you would normally see with a traditional primary care practice, with enhanced access, with time spent with patients, really listening and understanding, and then also, hopefully, as I think is the case with a very good clinician with good diagnostic skills, being able to provide a holistic approach to caring for my patients and developing long-term, lifelong relationships, which will benefit patients and myself going forward, because it's a joyous experience when you can find something that maybe somebody else hasn't been able to figure out the cause of. And I've seen that happen many times over the course of my career in my previous institution. So if you have any questions at all, we will be recording this session. There will be a link on YouTube for this. As I understand it, the tech team told me that this would be recorded and uploaded. If for some reason you cannot find the link information, you can certainly call Flagler Hospital and ask for Signature Health Plus Concierge Care, and they will connect you with our coordinator, Jennifer Cervello, or someone else in our department to talk with you about the specifics of what the details are about the program, what is offered, and the costs associated with it. But again, I think that medicine has advanced dramatically from a technological standpoint, but I believe that the art of medicine has been rapidly deteriorating over the last 20 to 30 years. And there are many patients, however, who, particularly younger patients, who are used to the newer system with less personalization, more fragmentation of care. But frankly, patients, myself and older, are still very much interested and used to a more personal and time relaxed visits with their physicians. Even when I worked at Mayo Clinic, I had primary care through their community internal medicine department, but I had some medical problems about 4 years ago, and I actually switched to their concierge program, and it was great. It was convenient. I got immediate feedback, excellent communication, which I found to be far superior to what I had received previously. And to me, that was a true value. So my entire family joined that program when we were still there. So I would encourage you to reach out if you have any questions. I would be happy to answer them. We could get back with you once you send me your contact information. And I look forward to taking care of a small panel of patients who really value what concierge care provides, and also the added value of my background in integrative medicine. We do plan to offer some integrative services. I should point that out. I will have a select number of supplements, antioxidants available in the office. I will have relationships for referrals for particular type of chiropractic care. For acupuncture, we will be offering some infusion therapy in the office. We haven't exactly decided what we're going to offer at this point, but there will be some opportunities for some infusion therapy, including antioxidant therapy and so forth. So, having said all of that, I also take the same approach to integrative medicine that I take with allopathic medicine, and that is make sure that the risks don't even potentially outweigh the possible benefits. So, not all integrative herbal remedies, for example, are safe or effective just because they're quote unquote natural. But these are discussions that I enjoy having with patients and having time to have these discussions with patients. But at my heart, first and foremost, I believe, a very well trained internist, worked at a couple of great institutions. I also worked at Cleveland Clinic prior to that, prior to coming to Mayo. And so I feel I'm well trained to handle traditional allopathic, in depth internal medicine investigations, but with a more relaxed and hopefully interpersonal based practice with my patients. So I thank you for joining me. I truly hope you reach out. This is going to be, I believe, a fast growing program based upon everything I understand at this point. I suspect we will be full within a couple of years. We certainly hope that's the case. And again, this will be posted on YouTube, but if you have any difficulties whatsoever obtaining access to this on YouTube, you can certainly contact the hospital for my department's contact information. And thank you very much again for joining me this morning. I hope this was somewhat informative, and I look forward to meeting you. Have a great day. Okay.